after a week off.
Playing a lot of Tears of the Kingdom, you know what I'm saying?
Me too.
All right, let me have one of those 14 by 17 sets back there. Thank you, sir. If you work in an ER or work doing morning portables in the units, you'll need to get very good at putting a cassette behind somebody's back when they can't help you do so. I did the hardest x-ray of my life yesterday. I'm not exaggerating. Most of the time these people will have a draw sheet behind them. Slide that behind their back and then adjust. And thus. Okay?
In a chest, right?
This is for a chest x-ray. Yeah. And
Or
actually,
use the, if there is a drawstring, use
let
the
me actually put that behind.
sheet to pull them forward. Because you'll get like 400 pound patients that can't move.
I could not, this guy, he was kind of contracted, and he was in a very, very fluid hospital bed. He was like sunk down in it. I could not get my board behind his back. I called the nurse, we moved him up. When we moved him up, he went, slid back down. I was like, okay. I was sweating, trying to get this cassette behind his back. And I finally got it where it was kind of like this. And I was like, great. It's probably gonna clip the costophrenic angles. I was like, as best I can do, so we're gonna see if this is gonna be on there. I told the nurse, I was like, be ready, I might be back in a few minutes. Processed it. Was it on the film? Yes, it was. I'm not a noob. Okay? So, doing this the right way now. You have a patient who's sitting up in bed. You're going to grab this sheet. You're going to put this cassette right here. You're going to tell the patient that this is going to be a cold, hard plate, and you are going to slide it behind their back. Their body weight's going to help hold it in place. You're going to reach beside them and adjust. Make sure that you can feel cassette on both sides of their body and that you've got a little above the top of their shoulders. Okay? Excuse me, Ty. Get this guy around. Make sure your tube head is straight down, directed at the patient. You don't want any angle on this either way. And a little bit of a downward angle on your x-ray tube, not much.
And there's no way to really measure the angle of the patient. You kind of just eyeball it. Right?
Yeah, just eyeball. Portable's a lot of eyeballing. What did you say?
Yes.
Take a deep breath. Me. Thank you so much. You've been wonderful. Best patient of my life.